While yeah, play the song.
Come along, come along, come along, come along. Mending it together. A world on fire can't last forever. We're gonna mend it together. A stitch in time is gonna save nine. A stitch in time is gonna save nine. And I wanna be a catalyst for change. Trying something different, I wanna change the rules of the game. 'Cause even the smallest bird can fly up to the top of the tree. And I wanna be a catalyst and find out what could be.
Hey, everybody. Good morning, good afternoon, good evening from whichever part of the world you are joining. Really nice to have you all on the session and to kick this forward and take it forward. So it's nice to see some old faces, some new faces, people from different backgrounds. So it's really nice to have all of you. This session is basically us looking at quality child protection systems across the world and how to ensure that we have well-being for all our members everywhere. This discussion actually kicked off at a lunch at the Child Helpline International Consultation in Stockholm. And I think it's something which started, but somewhere it didn't move. So we are going to start pushing it and making it move. And there have been bilaterals with quite a few people. But I think we thought this is Catalyzing Change Week, so we should have something linked to that. Many of you know Catalyst, many of you know Child Helpline. So actually there was to be a video on Catalyst. I think that didn't happen for some reason, but Catalyst is a network of social entrepreneurs and innovators from across the world. Child Helpline is also a member over there. Several of you I see on the call are members, others are not. And it has close to 2,000 organizational members, 3,000 members from 124 countries with chapters in I forget now, I think close to 50 countries. And in addition to all of that, where Mishri, who will be supporting you all on this, we have 120 plus collaborations, which we have. So I think that's something which we are looking at. And we see quality child protections as also something which we will be looking at in terms of a collaboration and partnership with child helplines, and whoever from you wants to take the lead to make quality child protection happen globally. So this is at the beginning of the session, an open introduction to whoever wants to be part of this core group to take it forward. Please, please, please do let us know and make it happen. Now with this, without further ado, I'd like to thank Patrick for joining. Patrick, I think you just went off, and I will hand over to Helen, who was there and has been taking the lead so far. Helen, over to you, my dear.
Thank you so much, Jaru, and thank you to everybody for being here today. I'm joining from the UK, so good morning, and amazing to see so many colleagues here on the call, so many Child Helpline members. Thank you. And I'm actually here with my kids in the background, so apologies for any noise in the background. And I think, Jaru, you gave a great introduction, actually, and perhaps I can further that in terms of, you know, the vision that we discussed when we all met in September in Stockholm for the International Consultation of Child Helplines. The idea we were discussing is really there are so many different measurements and ways to understand what's happening at the level of child protection in a given country. Actually, there are so many ways where this information could be overlaid and meshed together to understand really what's happening in terms of the quality standards, the minimum quality standards for child protection, and how we can learn and set some minimum quality standards where I think child helpline data can play a key role and actually be a key informer to these kinds of indexes and quality standards across the globe. So I think that's, again, a bit of an introduction into the discussion we had in Stockholm. And I think that for me, it goes back to this methodology, that's really ingrained in us at Child Helpline International, where the Child Helpline is the entry point into the child protection system. And, thinking of the child protection like a spider's web, where the Child Helpline is connecting the various actors, but also providing that, feedback into the child protection in terms of what children and young people are telling us, where those gaps exist, and where we can use that information to standardize and develop more and better policies that actually can protect children and young people in the long run. So I think it's worth reflecting on that methodology as well about that discussion. So welcome again, everybody. And I think in terms of today's discussion, the idea was that we set a rather loose agenda and really focus on discussion. We do have some guidance in terms of the discussion, and we will break out into different breakout rooms in some minutes. But I think before we do that, I'm just wondering if I can put one of our colleagues on the spot, or if indeed any others want to already kick off the discussion. But we have Joyce with us from CPAOR. Joyce, welcome. And I wondered, perhaps, given that you were also in Stockholm, if you also want to comment on this before we break out in terms of the policy perspective, or maybe from the child protection area of responsibility angle, and also the humanitarian response, maybe what thoughts you have on this. And then we can kick off the discussion, and I think then we can break out into groups. So Joyce, if you're there and you don't mind jumping in, give us a signal. Hi there, good to see you.
I think I'm there. I hope you can see me now. Hi everyone, nice to connect with you after Stockholm, and thanks Helen. So maybe just a couple of things that came to mind when I was reflecting on this. One was, for us, we work from a perspective of humanitarian action. So I know that not everybody works in that context. Other people work in the development context or non-emergency context, but we do have the minimum standards for child protection in humanitarian action that sort of guide the child protection services that are provided at country level, as well as prevention. But I think that for us also, as the entity that supports coordination for child protection, there is also a big question around standardization and who sets the standards. So thinking about localization, shifting of power and resources and knowledge, and what that means. So maybe thinking about, yes, the standards are usually set from a global north perspective, and how do we encourage the learning and leveraging of good practices and standards that are also available mostly from the global south. So just to have that dimension to think about while we're talking about standards, how inclusive are we in talking about standards, and what does that mean for different contexts? So just that's a key thought that came to my mind when we talk about standards. Thanks.
Thanks so much, Joyce. And I think jumping off from that as well, I mentioned earlier that there are many existing indexes, and of course, we recognise in this group, I think, the value of child helpline data, but how those standards can be simplified into one overview or one measurable set of minimum standards, I think the opportunity and the question that we're looking at today. So thank you for that. I know today we don't have colleagues from Out of the Shadows Index, for example, but I think they have really a lot to share in terms of the research that's been done over the last couple of years by that group. And I understand that the index is going to be hosted in a different agency soon. So with them moving to a different agency, there's also, I think, opportunities to integrate into the Out of the Shadows Index as well. So that's something that I think for this group would be, in the end, a key action point. I just heard from Mishri and colleagues that the breakout rooms, technically, we're not able to do that at the moment, which we can overcome, I think, quite easily by perhaps just having a larger group discussion. So if that's okay with everybody, perhaps we can throw the floor open. I know we have a lot of different perspectives here and a good regional and global representation, which is fantastic. So I'm just wondering if we can throw the floor open based on the discussion points that we've already raised, but also in terms of the questions that that we've posed, which I think are in the chat already. So if we look in the chat now, the questions that we were posing was, of course, discussing the different existing minimum quality standards, understanding the points that Joyce already raised as well, like who sets the standards. Of course, there are different levels of standard setting, regional and globally. And then in terms of understanding what minimum quality standards might look like, what some best practices might be to accompany that, to actually be an enabling and enforcing set of standards. And then some key elements of minimum quality care for children globally, identifying the role of child helplines, and then that goes back to what I said before about the data that's generated by child helplines. So you can see those questions in the chat. So please, if anyone wants to take the discussion forward, I invite you, based on those questions. Logically, we can start, number one, and then we can work through. And of course, we're happy to facilitate the discussion as well. So opening the floor.
I have a request, because I think there are some helplines, there are others who are not helplines, and we try to get as broad a perspective of people in this group. So it would also be nice if you could introduce your organization as you go. So I think that would be something very good. And adding to what Helen has said and what Joyce has said, is ultimately what we want to be able to do is see how we can come together. What are the advocacy measures that we need to take as a group, and not just as a group, this is a kick-off, start off, to make sure that every government adopts standardized child protection quality standards. I think that is very important, be it in prevention, be it in institutional care, be it in rescue or rehabilitation. So I think one of the things I really want to emphasize is that we are looking at the whole continuum of childcare and well-being. And I think that is something which is very, very important. I know some of you on the call work on prevention, yet others work. So I think it would be nice if you, when you're giving your comments, open it up. And firstly, I would say just start with, do you all think this is a good idea and we need this or not? We can first start with just that. And then we can take it from there. So, and I'm also happy that Yap is on the call. Nice to see you on the call, Yap. So, okay. Who wants to kickstart the discussion? All of you have to speak. It's a group of 24. We would have broken you into 3, but if not, now everyone has to speak. So, I'm going to call on you. So please go ahead. Do you think we should have this or not?
I think Nicole has her hand up and Ilya has there.
Okay, I can't see hands raised, so Helen, you'll have to do that. I'm on my iPad, so yeah, please.
Okay, well,
get team tagging.
What Mishri just said, I think Nicole and then Ilya. Over to you,
Hi,
Nicole.
everyone. I'm Nicole, and I'm from an organization called Leher in India, where we work on strengthening community-led child protection. Leher is about 10 years old, and before this, I worked with the Child Helpline in India, with Childline, for more than 10 years. So I think I've gone from the emergency response to preventive safety nets. That's kind of been my journey. So I think this is really a wonderful idea. And I'd just like to offer that perhaps some reflection, because there have been lots of shifts in the last 10 years globally. In India, there's conflict, there's climate change. There have been a lot of political shifts which impact child protection systems, services, the discourse changes. So as we get to minimum standards and quality assurance globally, I think we should map where we are, to logically arrive at what can be that common minimum that we can advocate very strongly for, and really placing that, and if we can take that forward in a systematic way, I think the standards will, that will evolve, will be more realistic, because there's tons of difference between the North and South. We've been hearing stories in the media, what happens to like Indian original families that have babies and live in the West. I mean, there have been some big stories going around. And of course, there's child helplines, and the role that child helplines can play in connecting communities to the system, and also enabling communities to find local solutions. Because that's been something that we've been working on for the past couple of years in India. And I think just the access to a child helpline makes so much information accessible to people to find their own solutions. So I just wanted to flag this. Thank you.
Thank you, Nicole. Over to you, Ilya.
Hi, everyone. Ilya from Childline Thailand here. I think it's a good idea. The implementation is another part. I think if you will look at what we have already seen in the world, let's say attempts at trying to bring some kind of system into child protection is probably the GC 13, General Comment 13 of the United Nations Committee on the Rights of the Child, which is dealing with Article 19, protecting, children from all forms of violence. The General Comment does come up with a certain minimal standard, let's say zero tolerance kind of policy on violence. However, the implementation and monitoring of the implementation is really, really hard. Also, if you look at that General Comment, all those experts, they were struggling with bringing the qualitative aspect to it, And in fact, if you look at the reports that countries submit under the UNCRC, it's mostly quantitative. They just throw the numbers, the statistics, and this and that, but the quality doesn't come through. So yes, I agree, it's a very, very much needed tool, but the implementation of it, it's not, one, it's not going to be easy. Second, we have to be really, really smart. And, due to the Child Participation Act aspect, and child helplines having direct conversations with children, we definitely need to bring kids into it, but in a safe way. So that will be my 2 cents. Thank you.
Thanks, Ilya. That's a really valuable 2 cents. I think that Martha from Kenya, you have your hand up. So please, why don't you take the floor?
Thank you, Helen and Jaru and everybody on the call. Oh, I should give you video.
Yes, please.
There, that's me. Good to see you again after a while in our meeting at Stockholm. Just reflecting on this discussion, there are certain things that we need to consider. And I think part of it would be identifying the role of various stakeholders in the development of the standards and implementation. And one key stakeholder here is the child themselves. So the place of child participation and just allowing the voice of the child to be heard and considered, because they have their lived experiences, they have their expectations. So we need to be alive to the fact that we need that opportunity to listen from the children themselves. And then in the recent past, there has been discussions around data protection, especially in relation to children and vulnerable communities. So that also needs to be considered, because as we implement the minimum standards, we are collecting a lot of data, but how are we collecting it? How are we managing it throughout that process, including when we're implementing the minimum standards? The other thing is that children do not exist in a vacuum. They exist within a family, a community, some structure, and so that is usually their protective net. And even as we target this child, we need to see how to involve this structure, this network around the child, to then be vigilant to protect this child and to promote or support the response process for this child, so that this is sustainable for positive impact for the child that we are targeting. So those are some of the things I think we need to consider, even as we think about the prevention and response and the minimum standards around the package for the children. And the states, we have different requirements and ways of doing things in different countries. So different states will allow different things, will respond differently. So what is the role of the state in this process, and how do we get the buy-in of the different states or countries, so to speak, to support this kind of initiative without creating conflict between what we are proposing and the legislation, for example. So there's a level of customizing that needs to be done at country level and even globally, because most of these things are also informed at the global platform. So all those are things that are in play that needs to be considered even as we have this discussion. Thank you. Over back to you, Helen.
Thanks a lot, Martha. I think it's really articulate the way you talked about all the different complexities. And I think one of the opportunities we have here is to look at those complexities and see where the minimum standards are. So thank you very much, Martha, for that. I know that Madhav had your hand up. Madhav, I can't see you on my screen anymore, but please take the floor. Over to you. Namaste.
Hello, namaste. Good afternoon. I'm Madhav from Nepal. We are working for the children, and in Nepal we have a very good, like in our constitution, child rights is the fundamental rights for children, and we have a very good Children Act and the National Child Protection Policy, and all the things given for the local government, because we have now 3 layers of the government, federal, province, and local government. But all the responsibility given to the local government, direct support for the children, and we have a child-friendly local governance system also. Like within the 563 local governments, only very few are now working for the children's support and system making. But from the government side, and the policy is very good, but implement part and allocation is the very weak and very poor, and that's the situation in our country. And how it will be take for the change, and how we can do for that, like to everything, build the system response, but policy is not work enough all the time, and so that's need a resource and their willing power also. That's in our country, and we try to better for it.
Thanks
Thank
a lot,
you.
Madhav. It's great to have all those points from Nepal. Thank you. I wonder if we can ask you, Yap, to join the discussion now. And I was thinking particularly how you might comment on how the UNCRC might be a starting point, a basis to identify some of the different minimum standards. So that could be a way to look at the formulation, for example. So I wonder, Yap, if you'd be willing to join the conversation now. And then after that, I think it would be good if we could go specifically into some of the questions that we want to raise with you. So welcome, Yap. Good to see you. Over to you. Thank you.
It's really nice to see some familiar faces on my screen. It is clear from the observations made so far that the question, how to ensure minimum care for children, is a question that when it comes to, let's say, the standards, as Ilya already noted, the standards are relatively clear based on the Convention on the Rights of the Child. Ilya mentioned the general comments on violence against children and how to prevent and protect children. There are also the International Sustainable Development Goals talking about healthcare, talking about food, talking about education. It's all in the convention. So let's say that in principle, governments, I think the governments of all here present at this meeting, the governments have an obligation, quite a number of obligations based on the Convention on the Rights of the Child that they ratify. Ensure that children have the highest attainable standard of health, make education primary at least free and mandatory. And there are many other of those articles like the right to life. So it's not so much, I think, the minimum standards. At least I would not suggest that you can adjust standards to the concrete situation in the country. The standards are set, and the question is, as already was mentioned, how to implement, how to comply with those standards. And so the bottom line is, in all the discussions, also in the context of child helplines, the question is, what can we do? What is necessary to ensure, or at least to promote, an adequate implementation of the obligations that governments have? And you can talk about all kinds of levels. Communities are very important. Children themselves are very important. As also somebody mentioned, they are the prime stakeholders here. And I think their possibilities should not be underestimated, but certainly most children need additional support. And the support can come from the local community, but the infrastructure of a child protection system or the child protection practice, the coordination, the availability of adequate services and all that is a obligation of states parties. And if you look at child helplines in particular, one of the key problems in my experience in the child helpline world is you get a call from a child. The child is in need of care, specific care. The child makes clear what he or she wants or needs. For a child helpline to find in the community or in the country the service that is necessary to help the child in an adequate manner is the kind of key problem. Refer to an existing service. Some of the services that you may want to use are not available. So the question remains, what is the solution? There is no one solution, and no solution is simple. The question, how to promote implementation of standards, obligations by governments, by state authorities at the region or the federal level. And how to do that? Well, the term has been used already. Advocacy is one, awareness raising, lobbying. There's a lot of work to do there. The question is whether child helplines in many countries living on very limited resources, how can they mobilize that particular activity, advocacy, political lobbying? It's all necessary. The bottom line, the option that we should think about is a government that fails systematically to comply with the obligation it has voluntarily accepted by ratifying the convention is to remind not only the state party, but also to consider the possibility of telling the state after an ongoing and systematic failure to send them a little note and say, listen, dear government, you are failing really terrible in doing what you are obliged to do for children in this country. It's a matter of providing resources for people who do try to protect children, to provide them with the care necessary. You fail to provide them with the resources. And you can tell us that you have limited resources, but it's also a matter of priority. So I'll see you in court.
Thank you. Yeah, I think
Well,
that's
the point is, that's easy said. But what I suggest is, in the world of child protection, start to discuss and consider the pros and the cons of litigating for the rights of children. It's not easy, but it is a tool that you should seriously consider. You are not making yourself popular in your country, perhaps, but you are not running for popularity when you care for children. So be serious in relation to the state parties. And listen, if you fail, what do we with people that fail? We help them as much as we can, but if they don't want to be helped, we'll take you to court. So I'm not suggesting that all child helplines in the world have to run to a court right now, but just have it as a matter of discussion in your tools to protect children, to provide them with the minimum quality of care that you want them to provide. The government, I have been around, most governments, of course, as you know, there is a lot of lip service by governments to the importance of children for today and tomorrow. As I listen, and we are talking about today, and we want you to do something. And if you don't, we ask the judge to order you to do certain things.
Absolutely. Thank you. I think that's a really powerful point to make and really well made, Jaap. Thank you very much. I'm going to bring in some other people. We have some amazing minds on the call today. So first of all, Florence, then it will be Marianne, and then Kajol. So over to you, Florence.
Good morning to everyone. Nice to see you again. Mine will be very short. I just want to what you have really mentioned about the governments is really true. That's why I've put up my hand in that recently the government approved a very beautiful paper on the Children Code Bill. So now it's called the Children Code Act. It has everything that we need the child to be addressed: child protection, health, and everything for the children. But now that advocacy has been going on for years, like 8 years, by different actors, UNICEF, Plan International, different actors, until now it was passed in Parliament. But the thing is, the implementation, they're like, okay, we've given you everything, and we've signed it, but now the implementation part, otherwise it will remain a white looking nice paper and all tucked in, everybody looking at it, but the implementation is not there. So I tend to agree what Jaap is saying. It's there, we've done our work, we've pushed for many years, now we have it. So the next stage the civil society now are doing is now let's go and raise awareness of what is in this Children Code Act. It says this, now we're trying to break it down. But maybe we should have done that to break it down the time we were advocating for the code to be in place. So it will take another, I don't know, a year or two again to try and break down what is in the Children's Code Act. So implementation is key to whatever we put on paper. Thank you.
So if I
Thanks,
can
Lawrence.
jump in. Thanks, Lawrence. That's great. Helen, is it okay if I jump in for a sec? So I'm thinking what I'm hearing from everyone, unless I'm wrong, is that everyone thinks we need to do a certain amount of advocacy, and that is necessary. But what I'm also hearing is that the advocacy needs to be very strong compendium of implemented solutions which work. So what I'm hearing, and please correct me, and that across. So what I'm hearing is what we really need to do is create this compendium which will help us in our advocacy rather than the theoretical frameworks that, hey, you know, country A has something, country B has something, and not everyone has it perfect. But for every aspect of the framework, we need to find what is the best solution. And I don't know who said it, but someone said that the solutions in the north and the solutions in the south may be different. High income, middle income, low income countries. So what may work in Sweden and probably Netherlands will definitely not work in India. So we also need to sort of create this using the framework. Am I hearing this compendium or whatever the name you call it, I'm bad with names, becomes a core before we start advocating? Is this what I'm hearing? I haven't heard. Can I see thumbs up for whether I have heard right or I have heard wrong? Everyone, even those who are not on screen, if I can just see thumbs up. And Helen, I can't see everything. So I see a thumbs up from Elizabeth. I see a thumbs up from Kajol. I see it from Claudia. I don't. Liz, yeah. Anyone else, guys? Yeah, Florence.
Yeah.
Yeah, I see it from Arfat. Don't see it from a few other people. Therese, Celia.
Cairo. Yeah, it's lovely.
Yeah.
Lots of thumbs up here.
Madhav,
Drew.
lots of thumbs up. Ilya, I assume. Yeah. Okay, so that's one concrete action we need to look at, which I think has not happened, which would strengthen advocacy, correct? I think that's what I'm hearing. And then I can't see whose hands up. So back to you, Helen.
Thanks a lot. Well, we're going to go right to Marianne and then Kajol and then Claudia. Please, Marianne.
Yeah, and thank you for. I'm Marianne. I'm from the headline or the helpline in Denmark. I think what Jaap said was, of course, very truth. And I think that from my point of view, we should use the media. We should use the what is working. I mean, today the court, yes, but the court in Denmark, at least, I don't know about other countries, but it's a very slow thing. And I think that what is working here to make changes is the media. So campaigns. I think it's a very important way of approaching any kind of problems like this. And I think also to have focus on what is the economic benefit for the countries to have focus on the children. I think that also might be a way that we can underestimate, and I think that is a mistake. I think we should really make it so clear how much economic benefit there can be out of putting focus on the child's well-being. So I think that that those two approaches could be really effective. Thank you.
Thank you so much. Kajol, please. It's great to see you. You're on mute, I'm afraid, Kajol. No worries.
Hello, everyone. I'm from India and come from Leher, and I think my colleague was the first speaker. So I won't go into any details about what exactly we are doing, but jump right back to where Dr. Yabduk and Claudia and others have spoken more on how to take this action forward. I think we've all agreed that a basic minimum standard is required. And while the last couple of decades, we worked very hard on getting the ecosystem done and seeing, whether the emergency helplines and other things get into action. And I think most countries, or a lot of countries, would have all of the policy and legislation, and as Dr. Yabduk said, lip service all right. But when it comes to implementation, we do know the child protection is also at the intersection. So it subsumes a lot of services, whether medical or health and, education and transportation, basic public services. So even to come to one definition of what the minimum services are, agreeing that we follow the guidelines and principles that are there in CRC and in other, other sort of international policies and things that are there. Even if we do, I think while Jeru rightly said, what we are talking even before advocacy is to have a certain framework. And I think creating that standards, and within those standards and indices of what the child protection standards has to be in each of these kind of areas, whether we talk, institutional care, or whether we talk rescue, whether we talk transportation, whether we talk media, whatever be the area, creating a certain aspirational kind of list of services to begin with, because when it comes to children, we immediately jump to the lowest common denominator. So having something aspirational and then maybe paring it down to something a lot more common minimum as per region, as per global north, south, as per budgets to sort of meet, and then creating a compendium based on which we advocate may probably work, towards a sort of a solution. That's somebody who's been working on implementation. I do feel that. Thank you so much.
Thanks a lot, Kajal. And I think it's coming through really strongly that these standards and the mechanisms already exist. And it's really about making them enforceable and making them more referenceable, if I can create a word there. So I think that it's good, again, to reaffirm that this is one of the steps we take is to map the existing standards, the existing mechanisms. And I think that it will be very much the first action that we take as a group. I'm really thankful for so much discussion here. It's really wonderful. And I know, Claudia, you have your hand up and you're next. And then after that, we'll welcome Joyce back. So over to you, Claudia.
Okay, it's great to be with you and good to see you too, Helen. We're not great participants, in fact, missed out in Stockholm, but benefited also from Stockholm for having substituted our system and got onto the Azello system now. But what I really wanted to say was, we're talking about advocacy, but we cannot advocate unless we create our partnerships. And our partnerships at national level and the building of trust mechanisms with the state and all other service providers who are serving our children. And this is what we've managed to create here in Malta, in being a significant helpline, online platform. We've been an online platform for 16 years now, and always developing and focusing our standards for the children and using the tools which the children are using themselves, not creating and placing ourselves in a child helpline which is not accessible for our children. Today they can reach us via WhatsApp, via Messenger, via Instagram, and all the tools that in fact our children are using. But I'll go back to the partnerships. As a child helpline and as a helpline, as an online platform, we are definitely a gatekeeper. We're a first point of reference for a lot of people who are coming on our platform. And the referral system to the services that are provided in our country are indispensable for the holistic care or the multidisciplinary approach which certain situations and issues are required. So the building up of all the contacts and the building of the networking mechanisms, which is so important for a helpline, which is there 24/7, available anytime, every day of the week and any time of the day. We absolutely, it's imperative that we have the networking. We cannot leave a situation for a child who's being abused, for a child who has suicide ideation, and not be able to refer at any time of the day. So here I will really stress the importance of getting service providers to understand what we are all offering as helplines, and for them to really trust what we are doing, accept the referrals, and take the necessary action that is required at emergency level, at humanitarian level. Plus also, we're talking about standards. Okay, I agree entirely that we all have different rules, regulations, different standards, different policies and procedures. However, we all have one thing in common, the well-being of the child. So the more structured we are, the more rigorous our policies and procedures are, the more funding that we seek and lobby with our governments. Today, we have managed a public social partnership in Malta with our government, fully funded service, which is developing every year with more support for the people who are using our service, and also the professionalism. Let's not forget that properly trained and also the professionals behind our telephone lines or behind our screens are most important to be giving the standards and keeping the standards that we're all talking about. Thank you.
Thanks so much, Claudia. I'm going to welcome Joyce back to the group now, and I think then after that we can summarize and wrap up. Thank you so much. Over to you, Joyce.
Thanks, Helen, and thanks, everybody. It's such a stimulating conversation, one that I haven't had for a long time, having to do a lot of procedural things in my work. But I think it's also very inspirational. Two things come to mind for me. One is going back to the question, I think, and if I hope I'm not misinterpreting what Yap has said, it's about accountability, holding the duty bearers accountable. And how do we get to that? I mean, we have the CRC, most ratified convention that there is, but in a way not very well implemented. So how do we hold duty bearers accountable? And Helen and I were having a conversation and thinking about something similar to what Jero has said, but looking at what do the SDGs do for children. I think the SDGs for me are quite general, and whether we are looking at something that helps us to hold duty bearers accountable, but also have some common standard of framework that allows us to push for services for children, to push for the protection of children, and to have a measurement around that. So just thinking, I'm not a big fan of the SDGs as they are, and I know that I work with the UN, so yeah, please don't quote me. But I think something similar to that, that brings us together to have a framework, as we've all said. And then the other thing I think that's very important, that's also been mentioned, is about showing what this investment means economically, but also pushing the agenda that if we're investing in children, we're investing in the whole population. I think that gets so forgotten, that if you make systems work for children, you're making systems work for the population and for the future. So just to try and bring those two things together, I think would also help us to move us forward. But thank you so much for your contributions. Very inspiring for me to listen to everyone today. Thanks, Helen.
Thank you. Helen, would you like to say a few things? Then I'll summarize. I've been listening, taking notes, and summarize and next steps from what I'm hearing.
That would be wonderful. And I wonder if I might already throw another action point in the mix. And sorry, Paige, I'm putting you on the spot here, but I'm just thinking about the questions that we raised. Maybe we can, after the meeting, put them in like a Jamboard or something so that we can collect some further responses. So I think that would be really useful, so that the people that have not had the opportunity to speak today, you can still give your voice And I really won't say much more other than I've really enjoyed this conversation, and I'm really happy to have seen so many familiar faces and also some new ones as well. So thank you from me, and over to you, Juru.
So thank you all. It's been really, really interesting, and I've been taking notes. And once again, my shout out to people, even in the chat, please put your comments down so we capture them even as the session is on. So please do that. As we go, I took forward 3 or 4 things, and let's see if you all agree, and if not, then shoot me down. Okay. One is there are standards which are existing, but maybe they are not comprehensive. So let's review to add what we think is comprehensive, make it more all-inclusive. Sorry, that was wrong English, but make it as inclusive as possible. So step 1 is don't reinvent the wheel. Please, let's use what already exists, because we don't need to start from scratch. We anyway don't have enough time or money to do that. So that's one thing I heard. 2, I heard is while we are reviewing, try to make sure we have an economic case, because money talks ultimately. So try to make sure that we have that. 3, I heard is leverage existing structures like the CRC committee, etc. I agree, SDGs are very vague, but they still provide a framework and governments listen. So we have to leverage existing structures as much as possible. So I think that is something which we need to do. And then, so these are the main things which I heard in what is already existing. What I heard emerge from all of you as a strategy, and I'm summarizing it with 3 C's. I may be wrong, but let's see. The 3 C's I heard is let's have a compendium where we write down all the innovations which are coming from across the sector. Let's start a campaign. So that's the second C. And if nothing else works, let's go to court. These are the 3 C's I heard. So I think our strategy is actually, I think probably I would like to add a 4th, which is let's go with our compendium to the CRC committee. I do know that we had a lot of traction when the CRC committee started giving suggestions. And so I think we can reinstitute that before we go to court, if that's okay with you, Yap. You know? So I'll add that a step, and then. So I think these are some of the main points which I picked up from y'all. Have I managed to miss something? I'm seeing a lot of things in the chat. No, okay. So I think this is something that we will do. So is everyone in for it? Do we start trying to see how to make this happen so that we have a lot of traction and can make things move and look at it? I also always like to end with, so who's going to be part of this? And who wants to take the leadership in trying to think of campaign strategies? Who wants to take the leadership in the compendium? And who wants to take the leadership in the court and the CRC? And for now, combining them. We need 3 people. And maybe if you, I'm going to, and I am on my iPad because anyway, if you can put your hand up for each, and then of course, you know, there'll be other people also joining in. But who wants to think about which 2, 3, 4, and you can be in all 3, that would be the best. But who wants to really think about campaigns? Marianne, it was your idea. So do you want to take that? And think about it. Who wants to join Marianne in it? Kajol. Marianne,
yeah, I think it's a good idea. I'm not sure that I'm the best one for planning campaigns. So
no,
eventually,
just do the experts. You know, Jamie Drummond, who is one of the world's best campaign designers, is on the board of Catalyst. So I will definitely call Jamie in and tell him he has to help us with this. And he designs campaigns. He was the one who made all the funds flow happen for HIV AIDS and all. So definitely Jamie will be roped in to help us strategize. So are you fine with giving ideas? Who else wants to be with Marianne on campaigns? Anyone else? Hey guys, we have to get action. Ilya, do you want to join how to think of a campaign? Let's not be shy, otherwise I'll have to nail her. Oh, fantastic, Martha. Love it that you're coming. Elizabeth, love it that you're coming. I love that you're putting it in the chats. So we have a really nice small core campaign score group. Paige, you're taking notes on the people we have, right? That's fantastic. Joyce is going to look at compendium. Fantastic. I'm assuming this is Helen's thing also. So Helen's also going to do compendium. Kajol has said she'll be doing compendium. So that's fantastic. Anyone else for compendium, please? We'll also send in the minutes and y'all can discuss it and get back also. Huh?
I will join Helen in the compendium.
Okay, how's that? Fantastic. But Yap, you also have to tell us how to negotiate CRC again. So the last one is CRC and court. So worst comes to worst, I'll start with how do we reactivate the Committee on the Rights of the Child to make sure that every time a country is coming, the compendium with the appropriate solutions goes to them. I think that's the most important, not a general thing, but saying, hey, you know, US, you're coming based on your situation. These are the 5 things you all need to do. I'm just saying who's on my screen. Thailand is coming. Thailand, you need to do this. Greece is coming. Greece. So it's taking from all over the world and doing it. Who wants to do CRC? Or should we, anyone who wants to say how best to do CRC? Madhav, you haven't volunteered. I don't see Cecilia having volunteered. I can't see hands, so I'm a bit difficult. So Yap, can I put you in CRC? Kamla will join CRC. Fantastic. Please put in the chat. Please put in the chat, folks. Yes, we will.
I happen to know the committee rather well.
Yes, exactly. Yeah. So you will lead that.
I know the mechanisms, but I think from this gathering, there have to be 2-3 people who want to have a discussion on how to access the committee, not only, but also with what do we want to access the committee? What is the issue that we want to raise with the committee?
Yeah. So I think I haven't heard from Florence. I haven't heard. So who else is going to go? Stefano, PJ. I think we have a few other people who need to think on it. So please add in the chat. I will definitely join you on how to make the committee happen, because I know that's the fastest way to turn around things and get countries to act. So, but I think before we go to the committee, we do the compendium, build a slow boil campaign. I'll ask Jamie to come in and help us to build that. And as we do that, we will create a strategy for the committee. Thanks, Florence. And we will send this across to all of you. There were several people who wanted to join today, but did not. Anna, do you want to say something? You had raised your hand. Anna? No? Okay. Anyone else? So we will also ask them. Does anyone else have anything to share? I love that we have so many people who have joined and that we have 3 perfect working groups. Great. Thank you. Thank you very much. Get back from your working from your agency and find out, and then let us know. Yep. Yeah. Anyone else that y'all have any other points to add? We have 1 minute.
I have just a small request. It's on terminology. The current terminology is child protection systems. I don't like terms like systems. So can I recommend to everybody here, if we talk about child protection and how to improve it, talk about child protection practices and not about systems.
Definitely. Excellent idea. Thanks a million. My bad. I think systems, and therefore I take full ownership for that. That's my systems brain. I apologize. I take ownership. But I really, really want to thank you guys. It's on the dot of 12:30. Helen, have I missed anything? No?
No, thanks, Drew. Great wrap up and great to see everyone volunteering. Thanks so much.
Thanks a million to all of you for joining, for being there, for contributing, and let's make this happen. So we will be there, and thank you to all of you for making this, and towards the next steps, we will make it happen. Okay, thank you and see you soon. Thanks. Bye. Bye.